The World Health Organization has declared monkeypox outbreak an international health emergency. It was announced on Saturday following an emergency meeting on the matter. It's the highest level of alert the WHO can issue and follows a worldwide upsurge in cases. Benji Hyer has the story.
This is a significant move from the World Health Organization, and this highest level of category is normally reserved for the sort of viruses like COVID-19, Ebola, the Zika virus, and also polio. What it does is raise alerts across the world that this virus is one that needs to be taken seriously and acknowledge that it requires a global response. The reason being is that something which started out a few months ago as atypical outbreaks of this rare disease in Europe and the United States has morphed into a situation where now we have 16,000 cases of monkeypox in 75 countries and so far 5 fatalities. Now, those have all taken place in Africa, but the US Centers for Disease Control and Prevention have this week confirmed that there are 2 of these monkeypox cases in children. And the reason that we should be noting all of this, of course, is that there's potential for further outbreaks. And that's really the warning from the WHO, which is this could be the start of spreading elsewhere. It still notes that the risk to a global outbreak remains low, and the risk to interference of international travel, in the same way there was during the coronavirus pandemic, that remains low too. That's because this virus is very different to the one that we're now familiar with, COVID-19. The first is that it's a much less efficient transmitter. It's not an STD, but it does spread mainly through contaminated surfaces or through bodily fluids, through sexual intercourse, for example, predominantly thus far between the homosexual community. But it's important to remember, of course, that same-sex relationships are still illegal in many countries around the world, and therefore prejudice can act as a barrier to help.
This is an outbreak that can be stopped with the right strategies in the right groups. It's therefore essential that all countries work closely with communities of men who have sex with men to design and deliver effective information and services and to adapt measures that protect the health, human rights, and dignity of affected communities. Stigma and discrimination can be as dangerous as any virus.
And there's something else to note too, which is that monkeypox is something for which the medical community has countermeasures already. The smallpox vaccine, whilst in short supply currently, is one that could also be used for this, and it offers 85% protection against monkeypox.